I am delighted to have you here, and so you can give us your experience about shoulder surgery in the last years.
Yes. Namaste. It's a very deep
Namaste.
pleasure, and I'm so privileged to be on this meeting with Daniel Moya. I'm fascinated how we can connect and stay in touch in this global world. It's really truly a global village,
That's
and
that's true. Really. Let me ask you, how did you get to become a shoulder surgeon? You are younger than me, you know, in our era, it was like by coincidence or by imposition of your boss. But
yes.
you faced a completely different situation. How was your experience?
Well, Daniel, to be honest, it was a very fascinating, serendipitous journey. It so happened that I was trying for a fellowship, and after a lot of obstacles, I won a Rotary International Scholarship, which was very hard because there were about 250 people who applied, and only four got selected. But the funny thing was, the fellowship gave me money. They gave me 13,250 pounds and said that within 2 weeks you must show us an university admission.
Hmm.
And here I was looking for a fellowship. I was not worried about the money, but the money came in and I didn't have a fellowship. And this is year 1997, where the internet had just begun. So there was very limited resources to get something in 2 weeks' time. So I sent an urgent fax. I rifled through JBJS, found out the fellowships on offer. And that was the year where knee was in fashion that time.
Uh-huh.
So I sent 10 letters to, most of them were knees fellowships, and there were a couple which were diverse. And I sent them off. And the first reply I got was from late Professor Simon Frostick. And it just happened that it was a shoulder department. And I was so fascinated that I just said, this is what I need to do. I don't need to do knee at all. And so I replied to him within 24 hours. And then other knee fellowships came in, which were pretty famous. But I went on with the shoulder thing.
Amazing. And was that your first time out of India as a doctor for training?
Yes, it was the first time.
Uh-huh.
So I went by myself, and it was a crazy journey, and it was a voyage of discovery. And once I went there, I settled in. And the whole thing was I started in reverse. I did my fellowship first, and then I did my registrar rotation later because the prof was happy and he said, you must do a formal training. So I rotated around departments after that for the next 4 years. And then my wife joined me after 2.5 years.
Is there someone that you consider your teacher, the one who marked your career, who have an influence in your career?
Well, the late Professor Simon Frostick was my mentor, and then later became my friend and philosopher and guide as well. And my PG teacher, Dr. S. Prakash, uh, I think a lot of my robust fundamentals come from him. And of late, I'm heavily inspired by Laurent Lafosse. So these are my sources of inspiration.
Good. You live in a very nice city close to Mumbai, Pune, and
Yes.
it's a very active. It's amazing how it is growing. It's for a visitor, it's really easy to realize that it's a very active, busy city. How is your life there? How is the life of a shoulder surgeon in Pune?
It's pretty hectic. As you know, here the practice is a little different from the West, where we are in the hospital in the morning, say from 8 o'clock to say 4 o'clock. And the commute is not too bad, although it's a big city and it's a very busy, traffic laden city. But for me, it's a 10-minute commute to the hospital. But after hospital in India, we all go to our private clinics. And so 4 p.m. I start my private clinics, and that goes on till 8, half past 8. And I'm one of those who follows a very strict by appointment schedule. My colleagues work till late in the night. I switch off at 8 p.m. because everything is by appointment. But I have compartmentalized my life over the last 6, 7 years where I operate on Tuesdays, Thursdays, and Saturdays. So I'm home at around 5, 6 as the surgeries are over. I don't go to the clinic. And my consultations are Monday, Wednesday, and Fridays. So those days I finish pretty late. So late in the sense 8, half past 8, which is not too late on this side of the world.
Good. So you have a very busy agenda. And what
Yeah.
about the how is the life during the weekends in India? How are the traditions? How do you spend the weekend?
Hmm. So Saturday is working day, but it's optional. So most of my colleagues would work the full day on Saturday, whereas
Okay.
I work half a day.
Mhm.
And so I would be home by about half past 2, 3 o'clock. And then we spend time with family, and usually it's some sports activity or a dine out and things. Sundays are main holiday when we recover, and by the time we've recovered, it's time to get back. So our Sundays are busy; they don't last very long. A lot of the weekends are spent traveling for conferences within the country. It's such a big country. Half the
Amazing.
time I'm refusing invitations to go because traveling is becoming, but there were years where I was traveling almost 22, 23 weeks in a year. So that's a bit much. I've curtailed that now. So I spend more time with family.
Good, good. And is there any technical procedure that you enjoy more than others? Like your favorite procedure?
Well, as a surgeon, Daniel, you know that surgery fascinates us, and it's always nice to have a good ending, a good result. The good thing about orthopedics is that the response is immediate. So what happens is once you've fixed a fracture and or done a replacement, you've done the X-ray. The gratification is immediate. I would have thought that the bursal approach to the arthroscopic excision of the paralabral cyst was a very nice new technique that I learned. But I'm very fascinated by the arthroscopic Latarjet, and that's because I started as a complete skeptic, and I was so much against the procedure because I'd seen, heard, and I've been across the world to so many friends, colleagues, seniors, and each of them was like, I would never do this procedure. So I started on a negative, but slowly I picked it up. And when I saw Laurent Lafosse himself perform, he did about 5 in a day for us when we visited him. I realized that this is the future. And of course, it requires relentless tenacity. And it took a long time for me to master the procedure. And the first few procedures were like 3 hours, 4 hours. And there's a lot of patience required by the entire team because they were all subjected to the same agony.
Yes, I just
Yeah,
would
yeah,
like to ask you, you came to our international meeting in Buenos Aires
yes,
almost more than 6 months ago.
yes,
And
yes.
how was your experience? How was your first time in Argentina? Was your first time in South America?
Well, second time in South America. I had a taste of South America a couple of years back when I was in Sao Paulo with our friends there.
Yeah,
And so it's a completely different culture, but it was a perfect alchemy of the ICSE meeting, meeting all our top friends who come at the same time. What are the chances you meet all the bigwigs in shoulder once in 3 years at the same place? And plus the Argentinian food, the culture, and the cuisine, your hospitality was exquisite. But to cap it all, we had the biggest presence of Indians at ICSC ever. Usually it used to be 4 or 5 of us. And this time there are bulk 20, 25, of which 14 of us were traveling together. And we decided that after the conference, we'll go across the length and breadth of Argentina. So we were very excited about the conference and about our travel trip because we went to Iguazu and then we went to Salta and then Purnamarca. And because it was 14 of us shoulder surgeons, it was a it was a big party. It was a big party.
amazing. Is there any conference that have touched you that you remember especially?
Well, two for sure. The ICSCS at Buenos Aires was perfect. because we expected a lot. It gave us more than what we expected. It was a very big meeting, but very perfectly arranged, went absolutely smooth. The content was incredible because I come back with a lot more richer experience. And even after such an experience as shoulder surgeon, I end up learning a lot more. So I was sincerely attending a lot of the lectures there. And the culture was amazing. The evenings dining outs were amazing. And then the other meeting that I would like to reminisce about is the 2017 ANSI course, because I was invited to operate. It was the first time an Indian was invited to operate and do an arthroscopic Bankart.
Mhm.
After all that experience, I still had butterflies. And so it remains as a notable milestone in my life. It will continue to be.
And what about your practice? Do you have any story that you remember, something different, something that happened to you related to shoulder surgery?
Well, there are a lot of anecdotes,
Mhm.
and there are patients who are fascinated with us, and there are some who are not happy. But this is the mango season in India, so some of our favorite patients send boxes of mangoes, and you may not notice it sitting from there, but we are putting on weight in this month because we eat a lot of mangoes now. But I think the one anecdote I would like to share was about a Tanzanian lady. They communicate on email, and you have no idea what the reality is, because communicating on email and actually seeing the patient is completely different. But she was a middle-aged lady who had a glenoid bone loss, and we planned for a arthrolytage. After the surgery was over, she told me later on that somebody recommended her to come to Pune for her arthrolytage. And she had no idea what Pune was and where Pune was in India. She was in two doubts, and then while she was in office, she owned an educational institute. One of her clients heard her talking about Pune, and he happened to have had an arthroscopic cuff repair by me a few years back. So he endorsed it. Moment he endorsed it, she decided she'll pack her bags. And they're very impulsive patients, the Africans. When she turned up, she was like BMI of 30, huge, 150, 160 kg lady, and she needed an arthrolytage. And when you promise somebody an arthrolytage and all that, and you look at this patient and you're like, oh my God. But touch wood, it went nice. And needless to say, she came back again for a rehab. She had so much faith in us. But it was fascinating how on earth Pune and Tanzania would connect. But that's strange. It's very strange. I can't explain it.
Good. Well, as you said, it's an international village, and now we are all connected. All those barriers and borders have disappeared. To finish, Ashish, I don't want to take much of your time. We could speak for hours,
I know.
but
Yeah.
how do you see the future of India related to the shoulder surgery, to shoulder and elbow surgery?
Yeah. I think that's very interesting because India and Pune in particular is growing rapidly. I'm told the growth rate in shoulder surgery is almost 30 and 40% unprecedented. Because it's such a wide, diverse country, I think over the next 10 years, we will continue to grow relentlessly at the same pace. The younger generation has a lot of potential. They are very focused. They are far better than what we were when we were young. So I'm very sanguine and hopeful about the future here. And surgical skills and their access to newer techniques has become very easy with the onset of internet and everything. I think the emphasis has to be data collection and research is where we are lacking, but we are recovering a lot of that area very quickly, because if we don't have data, then we don't have knowledge. That's important.
Mhm.
And it is us seniors who need to inspire the generation. We need to intuit them. And there are only few sources of inspiration amongst the seniors. And we need to expand that, because we will cast a lot of inspiration on them and motivate them. So if we can cover that area up, India is up for a real big innings for sure. But research is the future.
That's true. Yes, we are looking forward to our joint meeting between the Indian and the Argentinian Shoulder and Elbow Society in next month on Saturday, 27th of June.
That's right.
And
That's right.
we also are looking forward in the future to go to India for the International Congress of Shoulder and Elbow. I think if it's a matter of time, but this will come, and we will be very happy to support that and to enjoy that.
Thank you, Daniel. I think you spoke my mind, and this is something very, very close to our hearts. So, with your blessings and your support, I think it will happen for sure. And we look forward to the first Indo-Argentina meeting, which will happen in next month for sure. I'm really looking forward. It's a great exchange, and thank you for your opportunity that you gave us. You're connecting everywhere in a very big way.
Thank you, Ashish. It was a pleasure. We will keep in touch. Say hi to your family that I have the nice experience to meet, and we will keep in touch.
Yes. Thank you very much, Daniel. Give our love to MLC.
Thank you.
Namaste.
Namaste.
Stay safe. Take care.
Bye bye.
Bye. Good night. Good night.